We're getting a lot of questions on, in a nutshell, our goal. We've all got these ideas, and then all of a sudden it becomes overwhelming. So we want to talk a lot about the directives of the subgroups and, objectives versus the strategy. In a nutshell, our main goal is the name of our group, which is promoting economics. We have 4 categories under that, which is our direct caregiver. It's our family caregiver. And then we're gonna marry 2 together to make the 3rd subgroup, which is the 50+ workforce group and the multi-generational workforce group. So we've got 3 subgroups under our main goal. We will be coming up with 4 objectives that we're going to be baking into this plan, and then strategies on how to get those objectives working. So we're gonna spend some time on that before we get into our breakout. Then we're going to spend about 30 minutes in our breakout group. Julia's going to ask if everyone, Julia probably knows, but a lot of people have said where they want to go, and if you aren't in a subgroup, raise your hand. We'll put you in one, and if you don't have a preference, we'll slide you in to wherever we think. And then we're going to just do some working today. Again, kind of remember from last week, some of these subgroups have already been working, so they're kind of a little farther along. So if you haven't been a part of them, you may be catching up on that one. If not, that's okay. And then we're going to do that, and then we're going to come back after that, and we're going to talk in about 10 minutes. So I want one person from each subgroup to be able to give about a 10-minute wrap up of what was the group's conversation, what were, kind of where do you think the group's coming with the objective. We don't have to talk about that as much this time, but we're going to need to start talking about it by our 3rd meeting, because remember, we have a short span. So we got to kind of get going on what our objectives are, because we do want to be, really talking with the group on strategies, because I think that a lot of our strategies will cross, and that's okay, because that's fine. But we definitely will need kind of a cross section of strategy. So when we get back together with our large group after our breakout session, we will talk about our recap of what was discussed in the subgroup, and then we will adjourn. So with that, if there are no questions, I'm going to pass it to Julia, who's going to really talk a little bit more, just really kind of discussing objectives versus strategy, so we can walk into our subgroups very charged up on knowing what we're supposed to do.
Hi, everyone. I'm just switching the screen here. Okay. So you all received this template via email yesterday. If you did not, please let me know. But this is a template for the work group recommendations, and I definitely recommend browsing it after this meeting. If you have a chance, we'll go through it a little bit now. Recently, someone from another work group shared another little summary, another way to frame goal versus objective versus strategy. So I've plopped that in here, but the rest of this is in the document that you have. So these will be the format that we'll need to create our recommendations by November 15th of this year. So the goal, as Leslie said, is the goal of this work group. So that's already set. Promote economic opportunity for all Marylanders through an age-inclusive workforce and multi-generational consumer participation. So we just have one of those. Each work group will have we'll propose 4 different objectives. And then for each objective, there will be 8 strategies that we're going to recommend. And within each of those strategies, there are 8 different questions that we need to answer. So just to distinguish a little bit so that we're all on the same page in terms of what is the difference between an objective and a strategy. An objective is specific, measurable actions or steps that can help you reach your goals. So we're aiming for those that are familiar, we're aiming for SMARTY objectives and also strategies. But SMARTY stands for specific, measurable, achievable, relevant, time-based, inclusive, and equitable. So they're the how of you will achieve the goal, usually more concrete and time-bound than goals. An example of this is reduce hospital readmission rates by 15% within 1 year. There's some additional examples listed below in this document. In terms of strategies, of which, just to reiterate, we're going to have 8 proposed strategies for each objective, or up to 8, so that's up to 32 total. These are high-level plans or approaches that outline how you will achieve both your goals and objectives. It provides the goal or the map to how to bring together resources, actions, and policies to meet your objectives. So an example of this is implement a care coordination program that includes post-discharge follow-up and patient education. This is not an example for this particular work group. These are just framing what they look like. And again, we should aim to have those use the SMARTY format as well. Strategies may include enhancing or redesigning existing initiatives to improve collaboration, efficiency, and effectiveness, implementing systems change to build capacity of Maryland's public systems, the adoption of high-impact evidence-based programs and policies, and others. Any questions about that? I'll go over some of the questions that we'll answer about each of the strategies next, but just want to pause.
I would just share, I think that only because I've kind of been through this exercise a little bit, even with the other 2 subgroups, I think a lot of people will think that the strategies are what our objectives are, because they are so high end. I'm giving an example. Teresa in her family caregiving group, I think one of the strategies, because this is happening nationally, is that it was a study by PHI done on training family caregivers to be more a part of the care plan. And when that happened, there's been several states that have done it, or nonprofits. When that happened, they've seen a reduction in patients. I'm going to use patients, but people that are in their homes going less falls, less hospitalizations. So we tend to think of, that's the outcome versus the objective. So I go back to kind of thinking that these strategies are really high end. To put together a training program for the entire state of Maryland to help train our family caregivers is a huge undertaking. So you tend to think that's the objective. That's actually the strategy to help with your objective. So I'm just kind of giving it in, Julia's example was good, and we've used that in our packet, but I'm giving kind of one that's in our own particular work group, that these strategies are really big. These are really high end. A lot of these may be to go to the governor and ask for money. We talked about that. So objectives, I think when people said, how in the world are we going to come up with 4 objectives? The strategies are real high end. They're really rubber meets the road kind of thing. So might help everyone when you're kind of formulating how we get to a bigger objective. So just adding that, Julia.
Thank you.
Mm-hmm.
In terms of the questions that we'll ask, that will answer for each strategy. And Liz, correct me if I'm wrong. It's for each strategy, correct? Okay. So it'll be, how does the above objective and strategies advance equity and inclusion? Please identify any groups who are not included in these strategies. What key partners are needed to accomplish them? What funding or resources are needed? What legislation or policy changes will be needed? What data could be used to measure the success? What existing programs or initiatives support these strategies? How do these strategies reflect the input and priorities of older Marylanders? and any additional suggestions or comments. Yeah, go ahead, Liz.
And Julia, just briefly on that question of, do you answer each of these questions for each strategy? I think it also depends on the strategies and how aligned they are. So I think this information is to provide context, help to develop the narrative around it. So if you guys have strategies where the resources and the partners really align, you don't have to duplicate that work, right? Make it a little easier on yourselves.
Thank you. And we might want to think about it too in terms of spreading it out as like, what are the short term, medium term, and long term? Sound good?
Yep.
Great. Okay, let me stop sharing my screen. I've broken everybody out into the breakout rooms based on the interest that they've shared. I don't think we have anyone that we've not received input from. So thank you all for responding to those requests.
Karen, you had a question?
Yes. Julia, the form that you just went over, was that in the email that came out the other day
Yeah, it was the last attachment.
where it says background information for your subcommittee?
I believe it starts with, it's like capitalized template.
Okay. I have not been able to open that document, and I know that, sorry.
Nancy, you can't. Diane,
John-
you're shaking your head. Sounds like some people might not have been able to open?
Yeah, I think Jonathan was trying to help me and he gave me access to something, but it's not this.
The
At least it
email
doesn't-
that was sent last evening, I actually didn't use any Google Drive links. They're all just physical attachments to the emails.
Okay.
I believe it was probably sent around an email from me. It would be the last email that I shared. Because I know people are having trouble accessing the drive. So I thought I would just send it as an attachment instead.
Diane, did you get that email? Can you see the attachments? Great. Nancy, are you are you looking? I can see you kind of looking.
Karen, I would be happy to.
Got
If
it. I got it.
you got it? Okay.
I was looking in the other email. Okay. Thank you.
Moving forward, I'm going to try to I'll provide the links. We're working on organizing the folder now, but I'll provide the links and attach it just in case. It'll be a lot of attachments to the email, but it'll, at least one of them will be accessible. Okay. So one thing to note is we're trying to sort this out, but the recording, we're not actually. JJ, can I pass it over to you in terms of how the live stream will work while we're in the breakouts?
Of course. So during your breakouts, I will be cycling through each one of your breakout groups for about 10 minutes just to see what the conversation is about. Have that be part of the live stream itself. And if questions come from general public, I'll address them by reading out whatever the question may be or any input that comes along with it. So if there is interest, we will stay longer in your live stream. So I'll announce myself when I initially come in. But remember that we are consistently offering the public the opportunity to take part. So that's the point of this operation.
Thank you. And once we come in, the more we won't be able to capture notes as much we're going to try to, but in each breakout room. So the more that we're able to share and during the report out, the better for our notes afterwards. I am going to, if we're ready to go, I am going to launch us into the breakout rooms. Remember, we have direct care workforce, family caregiver, and employment of 50+ / multi-generational, since I might have paused. And
So
multi-generational.
Yeah. So Chase, are you doing direct caregiver? I can't see everyone, so I don't know if Meg or Cheney are on.
Yep, and I believe Cheney's also joined this call as well.
Perfect. Okay. And Teresa, you've got family caregiver. Our sub for 50+, she's traveling, I think literally on a plane right now. So I just want to make sure. She said if her planes get delayed, she's going to sit in the, so if not, I'm going to kind of be on there, but a lot of you guys will know so much more about this one. So I'm really looking forward to it, but I'm going to try to facilitate that as much with the rest of y'all. So we'll kind of be the three, there will be in each group, there will be an MDOA just so we can hit and remind me, Liz, I have to hit record. Is that right? Y'all think I know what I'm doing here, but I don't. I have to hit record when I go into the break.
We'll do record and transcripts. So that we can
Yes.
capture those.
And Mary, quit laughing at me. You know how I can barely do my stuff here. Mary's my neighbor here on the Eastern Shore, so she and I've played together, and she knows how silly I am. So, all right. With all of that, we're going to get into our breakout. We're a little ahead, so this is good. It'll give us a little time. We will come back at 2:00. Again, kind of, I just charge each one to kind of think objectives, but strategies, have a good dynamic conversation. And then we'll come back and then we'll kind of wrap up for 30 minutes on that one. I will just say, Julia, will you be the one bringing us back, or you?
Yeah, I'll keep track of time and bring us back. You want to go by the agenda in terms of the end time, and start report out?
We're a little ahead of time, so why don't we come back at 1:55? Does that work?
Yep.
Okay. We'll come back at 1:55 and we'll break into our subgroups and kind of start talking more of the specifics and get started. Any questions? Go ahead.
I just got an email from Kathy that she landed. I don't know if she'll be I don't think she'll be joining us.
Okay. Yeah. I said you are very committed. She tried also. I said, I got it. I'll take care of it. So I'm appreciative of her. And we will be talking about dates and next steps within your subgroups. So you know that. So I will be working with the 50+ to maybe get some subgroup dates going on. So with that, we will break in and we'll start getting down to the nitty-gritty and doing some work here. So
if you end up in the wrong group, a quick email if you're able to. You should be automatically sorted into the right room. Elizabeth, are you there? Okay.
I can.
Elizabeth, are you there?
And then Chase, if you don't mind, just
Hey, Julia.
Yeah.
Kate is here
I
from our
think I was
group,
going to be in a
but
50+ work group, and I got into direct care.
Oh, okay.
It would
I'm sorry
probably
about
would be
that.
helpful.
It's-
Same page from our
Remember, we used to
last
go into one big room
meeting,
with
which
human
was
beings, and we could just like walk across the hall.
Monday,
Tuesday.
Yeah.
last Tuesday.
Yep.
And-
And Elizabeth, I apologize. Do you mind introducing yourself again?
Oh, you're
Please
muted.
Mute. Sorry.
Sorry. Elizabeth Wagline. I'm CEO of the Elizabeth Cooney Care Network. We're a caregiving company that provides direct care for 67 years across the state of Maryland. I've also created the Certified Nursing Assistant Program, the legislation, the regulatory education, sat in the chair for a couple of decades, sat on the advisory committee for the CNAs under the Maryland Board of Nursing. So I understand workforce, obviously, in handling this, but also I've done advocacy for seniors through United Seniors, which represented about 1 million individuals. And also I was the chair under 2 governors for 10 years for the Maryland Caregivers Coordinating Council, which now has become the Maryland Caregivers Commission. I helped pass that legislation as well. And I've also been president of the Maryland Respite Care Coalition. Gosh, there's so many other things. I'm also past president of the Maryland National Capital Home Care Association.
Oh, wonderful. And I'm Cheney. I'm at Hopkins in the Department of Health Policy and Management at the Bloomberg School of Public Health. I have prior experience as a care manager for the Connecticut Home Care Program for Elders, which is my home state. But I've been doing research in this area probably for the past, what's this year, 24, probably 10, 12 years. And have been doing a bit of work with the state to better understand, or in the state rather, excuse me, to better understand the ways in which agencies, residential service agencies specifically, support direct care workers, as well as just characteristics about residential service agencies and the direct care workforce. The other thing that I was going to mention is that I collaborated with the Minka was very, very helpful in work that I started doing when Dawn Seek was leading the group a couple of years ago. And Caitlin Huck has remained a wonderful colleague and is participating in the direct care, in the care workforce working group that we have part of this work as well. So just wanted to say that. And then I don't know if Kate is able to come off of mute and introduce herself, but Kate and I work together. Kate Miller and I work together at Hopkins. We were both assistant professors, and Kate does a lot with workforce issues as well as family caregiving issues. And Chase is with us at Hopkins as well.
Right.
Thank you so much for that introduction, Cheney, and hi, it's nice to have the chance to connect with everybody.
Did I hear that you all have been meeting?
Yeah, so we started meeting when the LRM initially was formed, before the application process and reorganization and everything. And so I think that I think our group might have been the only group that had started to meet. The other groups had started to be formed, is my understanding. But our group was the only one that had met. And because we had met, I think the belief was that they didn't want to disband us, and they wanted to make sure that people's contributions were still honored, and folks were still able to feel involved. And so that larger group is actually part of this economic group, but myself and Meg Laporte are the co-leads of that direct care workforce, or that care workforce group that has been meeting. And so that's why I suggested that Chase sort of just review some of what we've talked about, since none of us are starting at ground zero, but just to sort of get a feel for what feedback there might be to some of the suggestions that have already sort of been made. And of course, if there's others that we did not consider or have missed, I think that would be helpful as well.
And what I'd also say and add to that, for your awareness, Elizabeth, is that we're still iterating and we're still kind of putting together the notes from the most previous meeting. So if you think of something, it might have already been shared, but we just haven't written it down yet. So I'll also say that. And I'll also give you a quick little overview, because I think we have time to present the board that we created on Tuesday. So I don't know if you can see my screen. I think things are loading for me right now, but that's great. So this is our mural board from our last meeting. And if you haven't used a mural board yet, just think of it as a really big poster presentation. There's little facets that everyone uses. And we kind of set our agenda to break out in work groups, very similar to the way that this meeting today is structured, but with everyone kind of coming from a different angle or different specialty with the direct care workforce in mind. We worked through an exercise called the How Might We exercise, where we focused on 4 different questions. And the 4 questions focusing on improving income and wages, a direct care workforce registry, retention and recruitment, and reporting and data collection. And thinking through the state's agenda of setting up sort of larger objectives and then having more specifics underneath those objectives, we kind of thought that working with those 4 questions would be kind of setting the stage for how we'd approach the objective setting. So what you can't see here, because this was our finished product, is that everyone added sticky notes to these questions below. And then we broke out into work groups to answer and to understand each of the questions. And I understand that the screen is really small, but essentially what they did was they took all of the ideas that we had from the ideation process and label it here based on difficulty to accomplish and then importance. And we kind of ranked them. And the goal of this exercise is that no sticky overlaps. You kind of have to find a place for all of these ideas. And then we have at least a function of analyzing it from the start. And obviously this is not a completely comprehensive list, but we could start somewhere and put pen to paper to narrow things down. And I'll kind of zoom in a little bit so you can see some of the suggestions that they put in stickies for the first question about wages and income. And I'll pause there. Elizabeth, do you have any questions or?
No,
My mother was the primary caregiver for for her parents. So, supported her through that. And I anticipate being eventually caregiver for my own parents, but beyond that, my experience is very limited.
Well, I'm still glad you're here, even if it's only for a short while, because your population, those who have very limited experience with family caregiving, they're the ones we really need to reach, because like Karen said, it's an opportunity for us to educate them so that they can be better prepared when that opportunity arrives. Because we all know what they say, you either are a caregiver, were a caregiver, will be a caregiver, or will need a caregiver. So we all need to do what we can to make sure that we make the process as easy as possible for people to get access to resources. And so back to what Ash said earlier, I just tell everyone to call 211. I tell everyone, if I don't know what county they're in, especially if I'm super busy, dial 211, tell them you need caregiver support, and tell them what county you're in. They will direct you to the Family Caregiver Support Office where you live. And when you get that office, ask for an options assessment. Now, I don't know if you do that, Karen, in your office, but I know that asking for an options assessment means that they will come in, they will meet with you, or you'll meet with them at their office, or even just over the phone. They will tell you what options are available to you. And that's a good place to start. And so, like Kenny, I was a caregiver for 25 years, but I didn't identify as a caregiver until about 6 years ago. I just thought I was a wife who was taking care of her husband. I had no idea. When I heard that term, I thought it must be for someone else. That's not me. And then I thought that a family caregiver was what they did if you were a professional caregiver, those people who get paid to do that for a living. I said, well, that's not me. So again, I'm not a caregiver. So there's a lot of work to be done to help people identify. So let's talk about the topic that we were given, promoting economic growth. What objectives and strategies can we put forth to help promote economic growth as it relates to family caregiving? And I can share one, but I do tend to monopolize conversation. So I'm going to let you guys, if anyone else has a thought, I want you to share it before I start talking.
One of the things that me and Miss Leslie and I we discussed this earlier, Julia might already, I think Julia was also in the conversation. We were discussing about the tax credit for the family caregivers. And I'm not sure if that is what was on your mind, Teresa.
No, but that's a good one.
Yeah, so we were just talking about that there should be some kind of tax credit for the family caregivers, just to offer them some kind of encouragement for what they're doing. It, of course, does not compensate all the work that comes with all the efforts that we're putting in and the energy. And I personally feel that it's a lot of mental stress as well that goes into being that person. You're taking care of your jobs and your families and everything, and then you have that extra thing to take care of. And it's a lot of work. So we were just discussing about tax credit that might just be something a little bit helpful, just like a child tax credit, something that needs to be incorporated for family caregivers as well.
Right, and that's a good one. There's also the family medical leave. What was that? Family medical leave insurance that we were working on. That's another one. And maybe a little bit more of my story might help, because if you're a short-term caregiver, the impact is sometimes as you know, it's not as extensive. But when you are a long-term caregiver, I was a caregiver for 25 years, so that meant I had to make decisions about what jobs I could take and where I could work, because I needed to be available to help my husband and to take care of him. I had to make decisions about like I had a job in DC for a while, but then I had to leave that job, and I could only take a job that was no more than 15 minutes from home, because I had to come home every day to check on him. Sometimes just to check check his blood pressure. Sometimes to rush him to the doctors or the emergency room, whatever. I needed a job that provided more flexibility. And over time, I think about 5 years ago was when I made the decision that I couldn't work outside the house. It wasn't safe for me to do that and leave him at home, because it wasn't safe for him to be at home alone. And so I had a company, this small company that I started 17 years ago. It was more of a hobby. Now it had to become my full-time job. So my retirement income took a hit. We had to borrow against my 401k to meet expenses. I mean, it's expensive to work from home and to start a new business and to take care of your husband. And so my caregiving life ended in October when my husband passed away a year ago. And now I have to deal with retirement. What is my retirement going to look like, since I've depleted most of my retirement income, right? And what experience or what do I have? What jobs can I take outside the house now to help take care of me for the rest of my life? Don't be concerned. I'm not concerned at all, because my business is doing well. But I have what I call wherewithal. Other people call it wherewithal too. I have wherewithal. I know how to make things happen. But there are a lot of people like me who do not have that. They struggle. They struggled because they didn't have the skill to figure out how to earn an income while they worked from home and took care of their husband. So what I think needs to happen is a conversation about how to provide opportunities for people to up-level their skills, so they can learn how to either start a business or have conversations with their employers. And employers need to be more understanding about family caregivers and what they're going through. So there's a lot of work that has to be done there. And I actually don't have all the answers. Those are the two suggestions I want to put forth, that maybe something can be done to help family caregivers understand that they do have other options to earn a living, maybe build something for themselves. I don't know. So if that helps, I thought my story might give you a little bit more background for someone who's doing this long term. And if you're taking care of a child, you may be in the same situation. You may have a child that's disabled, and you may not be able to work outside the home because you have to care for that child. Well, what's that going to do for your income, your household income? You're not going to, unless you figure out how to earn income from home, which you can do these days. It's going to have an effect on your family, moving forward, the economic growth of your family.
So we're looking at, I'm sorry, Karen, go ahead. It's okay.
No, go ahead, Ash.
I just wanted to kind of change a little bit. So like creating flexible work, training, and growth opportunities for families in terms of their financial growth. Is that what we're looking at, Teresa?
That's one of the suggestions that I want to put on the table. I know we're not going to make all the decisions today, but I thought that would be a good one to lay out there. And Karen?
So many things going through my head. One thing I want to put a pin in is something you said, Teresa, just to kind of put in a parking lot for a conversation at some point in time later. We do see an increasing number of elders who are caregivers for children that have had prolonged, lifelong developmental disabilities or other disabilities where they cannot live independently. And now we've got caregivers who are in their 80s and they don't have a plan of what happens next and they're exhausted. So I wanted to put a pin in that because you talked about children. Another thing I wanted to mention, it's sort of along what Ash was just saying, is, you know, we talk so much about childcare benefits just a soapbox moment here. I think we tend to focus a lot on kids, and I have kids and I've raised kids and I love kids, but I think we're at that critical pass where there are more older adults turning 65 than kids entering the school system. And I don't know exactly that is right, but it's something like that. I think we're pretty close to that point and we don't talk about this enough. So, and honestly, I feel like I had as a family caregiver more resources at the ready for me when I needed help with caregiving for my kids than I have for my mom. And that's complicated in part by something I think that tips over into the workforce work group. I can tell you, you know, I am in my community. People know who I am and what I do. But when I called an in-home care agency to look for services for my mom, the very first day that they were supposed to come, they didn't turn up. And we contract with providers. So, you know, not that I'm trying to say I'm special, but, you know, you would think this would be like a relationship that somebody would want to do well in. So I know exactly how challenging it is to find good help. And if you might have the money to pay help, which a lot of people don't. So I think that caregiving ability is also sometimes influenced by the resources that we have at the ready or within our reach. And I feel like in some ways we need to look more towards the system of supports that are given for parents in the workforce and parents in the community, because we're really not dealing with things that are that much different in terms of the kind of help that we need. But we don't have that dialogue. You know, we talk about parity with a lot of things, but that whole process of being a parent needs to come full circle into being a caregiver for a family member who's dealing with end-of-life concerns or just dealing with support needs. I can tell you in the Office on Aging across the state what we have, because we all have the same things. So we have the National Family Caregiver Support Program that is federally funded. And that program is a little different from many of the supports that we have through the Office on Aging, because it is not so much means tested. In other words, we can help people who maybe have a little bit higher income, and we do. But in my agency, the way that we work our National Family Caregivers Program is sort of more of a one-time to the well situation, because I have a limited amount of money and I can't keep helping the same people year after year after year after year. That doesn't mean we never help again, but we help with things like some more one-time or one-off kind of things, like somebody calls and they need some home modifications done, or they're preparing for a loved one to move in with them, but they need a modification of some, like maybe they need a help with a ramp, and we partner with a local home repair organization, some churches to get those done, and maybe we offset the cost of the supplies. Sometimes we have somebody that calls and they need, there's a utility shut off, or so there are emergent concerns that are sort of a one-time situation. And it's a limited amount of funds. I don't think we generally keep it under 3,000, and that's not a lot of people that get that much money. It could also be used for respite. So say I'm a caregiver and I have to go into the hospital for surgery, or I need to travel out of town for a wedding and I just can't do this thing in my life without some help. So we can help with respite stays. We sometimes help with other expenses, like dental issues are always a concern and very expensive and not well covered by other benefits. So we get people who are literally dying because of their mouth, because of their teeth, because of infections and whatnot. The other program that all of the area agencies have is a program called Senior Care. And Senior Care is a state-funded program. And that program provides, it's managed a little bit different in every jurisdiction. I'll talk about how we run our program. People must be, this is unilaterally across the state. You have to be functionally eligible, and that is assessed initially by the Office on Aging. And then if we find somebody all the other boxes of eligibility, it's confirmed by our health department partners. So the nurses go out and do an assessment and say, yes, this person scores here. They could have, their functional level could be up here or down here. And that does have to do with some waiting in terms of the wait list that we have and how quickly someone might get services. But there's also a financial eligibility that people have to meet. So there is a means testing for it. So it's serving lower income people. And then what we do if someone meets the eligibility and we have a slot in the program for them, because again, funding is finite, we can connect them to several different things. One is in-home care services. The way we do that in Hartford County is we contract with in-home agencies and also adult daycare centers so that we can cover up to 2 days of adult daycare and gap filling in-home support. So that means like we're not doing 12 hours of care. We generally doing like 3 to 4 hours a few times a week. And that could be help with chore service. It could be help with personal care, showering, bathing. It could be respite care, 2 days of adult daycare. We also help with co-pays for nutritional, incontinence, and medication supplies. And everybody has basically a plan of care that they're assigned to or that is written and personalized for them. And then they can choose from the people that we contract with that provide those services to benefit from those services. You do not have to have a caregiver to get senior care. So this sometimes is serving people who don't have caregivers. You do have to have a caregiver to qualify for National Family Caregivers Support Program.
Job fairs, designated job fairs, just like, we have a workforce department and they hold workforce trainings and job fairs. And then lastly, I would say they should really be helped with the CV developing. So my experience, let me share. I had like 15, 20 years of clinical experience, and wherever I would apply for a job and they would tell me, oh, you have wonderful clinical experience. You're when I started my career as a public health person. So you don't have, and this will come out of the recruiters or the people who did not have that much experience, I would say. And you understand, and you know what I'm saying, because you guys are so experienced in your field, you can look at the person and tell like there are transferable skill set, right? So we just saying that, oh, you don't have experience for this thing, or you don't have experience for this particular item, but there is transferable skill set. We know that, right? So all these things could be translated on CV to present, because what happens is the CV or resume is the number one thing that goes anywhere. And it does not have your picture maybe, or it does not have anything. And we say that we shouldn't be judging the book by the cover, but yes, this is true. We judge by, by the book cover. And especially with AI, I don't know how this is going to play out with AI getting so common. All these things are going to be more relevant, that it should be really transferable skill set should be presented. The person should be present, the whole life and the experience of the person should be presented in a way that they will look useful.
Gotcha. Those are great comments. Thank you.
Thank you.
James or Carolee or Dora, anything to add before we kind of circle back around to wrap up on a couple of things? Yeah, go ahead, James.
I just wanted to mention that we should not lose sight of the fact that LGBTQ and HIV populations are, according to the Older Americans Act, are populations of special need and need to be included in any plans for workforce development as well as employment.
Oh, absolutely. And I think the diversity is about definitely a huge part of our plan. It needs to be diversity, with all of these underserved populations needs to be part of our strategy to get them into the workforce just as equally. So I agree 100%, James.
Thank you.
Dora.
I just want to echo what everyone said. I thought there were so many great ideas here, especially the approach of having one set of thoughts for employers and one for employees. I will say, I think targeting employers is going to be really impactful because I think everyone on this call knows that older adults are fully capable of maintaining their work and are fully capable of learning new skills. But because of ageism, a lot of employers don't see that potential and skill. So I think it's really going to be like this big mindset shift that we have to encourage.
Yeah, I agree. No, I agree. So with our 3 minutes left, I had a question. So is everybody up? We will have 2 more meetings to be able to do these breakouts, and we will do that. I think our next meeting is October. I don't know. It's on y'all's calendar somewhere. So instead of me spending time, but it's a week after next. We're probably going to spend about 45 minutes in this subgroup. But let me ask the acceptance or your availability. Our next meeting is the 8th of October. Do we think this subgroup would need another meeting between now and then, or we could do emails between now and then and use October 8th to do, it's going to be more of a 45-minute. So there will be a little bit more time and then maybe another meeting after, I guess. So anyone's thoughts on adding another meeting date between now and the 8th? First question. And second off, do we think that just between our 3rd meeting and our 4th meeting, that's enough for this group to do? Or are we going to need to get some meetings out? Because we could then just do some doodle polls to try to find the best time. Any thoughts on that? Mary?
So the 8th is for the entire work group. I'm trying to get what the agenda would be for that meeting. Would we be prepared for that meeting now without a subgroup meeting? Or do we really need to get our ideas more shaped up for that?
Yeah, that would be the question. We are going to use that big group meeting though to do another breakout like we're doing now, and it'll probably be more around 45 minutes versus we did about 35 minutes today. So it will be a longer breakout because we don't really need to talk about the big group as much. So we'll have more time, but yes. And Nancy, you got any thoughts on?
Yes, I was wondering if we could get some summary of this meeting and really digest it. We've had a lot of good thoughts here, and to break things into objectives and strategies might take a little more of our time apart from the meeting. So if we could see some kind of summary or a link to the recording or something, and then maybe come back a little more prepared to use that 45 minutes.
I think that's a great thing. Carolee?
I wanted to follow up on, I think it was Monica's idea about sending in our recommendations. I think that'd be a really good idea if somebody would be willing to aggregate them and send them out in an email. That way we can review them. And again, to Nancy's point, to come back more prepared the next time.
Okay.
Everybody would kind of be on the same page with their ideas.
Gotcha. Monica, is that what you were going to kind of suggest?
Yeah, definitely. And also, there's a lot of work that's been done in this. And we really—
I'm all about not creating the wheel.
Yeah, exactly.
Love it.
So there's professional outplacement assistance service. Okay, that's for professionals when they need to go re-enter or thinking about something else. Then there's CSEP, then there's the Maryland Workforce Exchange. We really need to use the entities that exist to actually, be the ones who are the drivers for these strategies. Because, we've mentioned a lot of good stuff, but there are entities. I know like the JCA in Montgomery County has a job fair, but you know what? It doesn't do what like 15 employers come and they say, okay, we need bank tellers, or, that's not where we have to go. The state really has to be one of the economic engines in this thing. And just one last thing. The template said something like the 50 plus workforce and a multi-generational customer or consumer. I don't think we're necessarily saying about the consumers. This is the a multi-generational employee population, so that we get into, phased retirement strategies. We get into, there needs to be new pathways, I think, that the employer is willing to say, hey, when somebody wants to not work full-time or wants something else, this is a pathway that they can go down. It doesn't exist now. And to be longevity ready, we really need that.
Yeah. Let me look into that multi-generational, because we talked about that. So if I missed a word.
Yeah. I don't think it's right. Did anybody
let me reread that one. So I'll make sure. I do think, though, as a follow-up, so I think what we're coming to is, and I will get with our sub-chair, and I have taken 3 pages of notes. So we'll be in communication via email of this subgroup. I do think the recommendations, and we definitely can get everyone's recommendations and any notes under that. We can work on getting that together. I do think it would be very helpful, Monica, for us to send, any reports, any studies that have been done. So we might have some, but I might be reaching out to a couple of y'all on things that you've said. I love to send the link to CSEP in case anyone doesn't know what that is. I'm just learning that program myself. This is definitely kind of newer on my radar. And, send maybe some other entities so people can kind of do some of the research between now and then. We'll then take our next big meeting, which is our 3rd meeting of the big group on the 8th. And we will take our 45 minutes of the breakout, and we'll have some directives before then when our chair kind of gets back in it, and I will meet with her. And so we can kind of do some of the work. Nancy, I think you're exactly right. Let's do some of the work now. Let's digest all of this. Let's do a little bit more, and then we can come back in, and it probably will include a meeting maybe after that. And just to remember, the big work group has a meeting 3 and a meeting 4 scheduled, but we're not done until the 2nd week of November. And I purposely kind of loaded up the meetings at the beginning of this time frame, so that if we need to have a meeting or 2 after, we can. So we have until November-ish. So we do have some time. So does that sound like what we're doing? I think we're going to get called back in here. Nancy?
Yeah, I also wonder if we don't have a lot of time, but could we collect some of the materials that are out there in one place and just have that as a resource for us? I'm sure there are far too many to understand in this short period of time, but if we could sort of get a core of materials on the research that's been done, I think that would inform what we're doing as well.
Yeah, I'll need to see what we have, and what we have included and what we haven't. Now here comes the challenge, Nancy, is we've got everything on this Google Drive, which is just as hard for me to access, and I'm inside. So I get y'all's challenge. So we are talking through feverishly a better way for us to communicate that. That's why Julia is kind of just she's just started sending out the documents. Our Google Drive and you getting access to that is not as nearly simple as we kind of thought it was. So we need a better method for that. and we'll talk in the next couple of days very quickly, Nancy, on that. And if not, we may just kind of send some of these resources out. Yeah, Mary, go ahead.
Sure. What would you like to suggest an address at this time, an email address at this time where we would send our thoughts to, or should we wait for you to reach out to us and respond? You want us to send you information or thoughts?
Oh yeah, you can easily send it to me and Julia. Send it to me and Julia, and we will funnel up. We don't need to set up any new things like that, and I will get it to our sub. And yes, we'll keep it all together. We have interns. We have a great intern sitting on with us now that's really helping us keep this all together. But I do think that there are a lot of the entities and the reports kind of you talked about. So Monica, I may be reaching out to you and Diane on a couple of things you said, so that we're giving this group all the resources. We can put our work in, and then when we come back on the 8th, we've got some of these things behind. As I have said, and I kind of said this at the beginning, a lot of work has been done. Let's don't go back and redo other works. Let's also don't get frustrated on the work that's been done and maybe nothing happened. We just pull it together. Let's just pull it up to the surface again. You know, I've been doing this with the workforce group. I have, like I said, I've sat in every one of them. We made a ton of suggestions. We're making little small pathways, so we'll get there. So. All right. I think that we're going to be called back in here soon. Yep. So in 28 seconds, and the mic and camera will be turned off, and we will come back in. So I appreciate everyone. This has been a great suggestion. I'm with you. I didn't even know half of this. What an awesome discussion. So thank you very much. I agree, business. So, all right, we're down to 2-1.
But I'll share with you the program. I'll share some notes on the programs that Karen mentioned.
Thank you.
I think Jonathan did mention that he started the recording, didn't we?
We've got the recording for this main room, but in the breakouts, it wasn't allowing us to start it, unfortunately.
Here we all are coming back. So it worked.
My apologies for bringing us back a little late.
That's okay.
Leslie, Teresa has to sign off a little bit early, so it might, when we do the report outs, if we can have family caregiver go first.
Absolutely. Absolutely. All right. So I think we are all back. I just for our 50+ group, I didn't know Mary or Monica, if either one of y'all want me to report, or if you think y'all could report. Everybody doesn't need to listen to me all the time. I sound horrible sometimes. So I don't know if either one of you want to raise your hand. If not, I'll do it. But while we
fine.
Oh, thank you, Mary. So while we were doing that, I hope everyone had a great conversation, maybe some set dates. So Teresa, since I know you got to run and you and I need to catch up later, just so I'll kind of hit you up. But how did the group go, and what did y'all talk about that, maybe all of us can stay on the same page? Because we did talk about some things that I could tell was going to go into other, not even just within our group, but we talked a lot about ageism and the issues that we have. And that's in a whole nother main goal that we have in Longevity Ready Maryland. We can marry a lot of our strategies as a big whole. So this was really good conversation. So tell us about your subgroup, Teresa.
I agree with you, Leslie. Some of our topics probably do fit with other subgroups, but we discussed the challenges of family caregiving, financial challenges that they face, the access to information, some issues around individuals identifying as a family caregiver, knowing how to get access to resources, Some of the ideas we wanted to put forth was the family caregiver tax credit. Let me know, Ash or Karen, if I'm getting it wrong. Family caregiver tax credit, also family medical leave insurance, and we had Karen from Harford County Family Caregiver Support Office really share with us a lot of resources that are already available to family caregivers and how the program works. But we agree there's a lot more work that needs to be done. And so, Karen, I don't know if you want to share a little bit more about what we discussed in the room, but that was my take.
Excellent.
I think you did great, Teresa. The one thing I will add is that we talked about the fact that while each jurisdiction has an Office on Aging and the programs we discussed are available through each Office on Aging, our funds are limited and the need often outpaces the funding that we have available, but also there is the whole issue that some of the programs do have financial eligibility, and when people fall outside of that, we're not able to help in the same way, and that really limits the supports that we can provide, and that's hard for a lot of families because they still need help and they don't really have the means to afford what they need, but we can't fit them into our program.
Yeah, these are great discussions. You know, I'll share with the group, and if I did this before, I apologize. So there's been a big national study with PHI, which is, I'm gonna be honest, I don't even remember what that stands for right now. Liz will probably help me out so quick. She's so much better at these things than I am. That talked about national family caregivers. Family caregivers is going to be one of the biggest things we talk about in the next probably 10 years. And currently there are 5 states in the United States that offer a family tax credit, just like you have a child tax credit, which I think is like up to $3,200 or $3,600. If you have a child under 18, you can take this credit on your taxes. In 5 states, they have this. If you are a caregiver and you would have to come under that, you could get a tax credit because it becomes very expensive and that just helps to pay, right? There was a bill that went through Annapolis this last legislature, and it started off as that. It got completely flipped upside down. It came out as kind of more of a caregiver voucher, that a caregiver, if you were a caregiver, you could apply to this fund. It was a discretionary fund by Maryland, and you could get some sort of reimbursement. That was certainly a nice step, and there wasn't a lot of applauding of this particular bill that passed. Then everyone kind of realized that, unfortunately, kind of like the paid family leave, which there's already a bill that's passed for paid family leave, just like New Jersey has, but there's no money. So we don't have that, because to do that, everyone would have to give taxes in their paychecks, and no one wants to do it. So we passed family paid leave, just like New Jersey has in California, but we don't have any way to fund it. Same thing happened with this caregiver. We don't have any way to fund it because there isn't any money. But progress is progress. It's always, to me, I always say it's not about perfection, it's about progress. So I do think that the family tax credit is something that is going to swirl around for quite a while as a particular option, something that we need to discuss. So I applaud your group, Teresa, for talking about that. So wonderful. All right. What about direct caregiver? Cheney or Chase? What you guys kind of talked about, and they've been doing an awful lot of work up until now. So you might have just been talking about the work that y'all been doing. It's a very active group.
Yeah, so we had a nice overview to some of our new team members about how we've thought about this problem. We collected resources pretty much all summer. So we've been doing a lot of evidence-based work and narrowing down kind of key strategies or solutions to manage the challenges that we found the most pressing to the state. We kind of labeled it into 4 buckets, as Cheney mentioned last time we met, talking about income and wages, direct care workforce registry, improving reporting and data, and then finally retention and recruitment for direct care workers. And then the last meeting that we did, which was last Tuesday, we compiled a ton of strategies to improve all 4 of those categories and then labeled them based off of importance and difficulty to enact. So what we did today was we kind of went through the list. We actually had a couple of students in the last couple of days compile all of that information, put some resources together, and so we can start reacting and also start making our objectives a little bit more clear, like you have in your template. I know we'll put some sort of numerics or some sort of SMART goal attached to our objectives, but we're working from, like a 30,000-foot view and kind of narrowing it down from there based on some of the strategies that our experts have labeled important. So that's sort of what we discussed. We also, we have a long way to go still, but it's nice to have pen to paper and to react a little bit, but yeah.
Yeah, that's great. I'm going to go back. So Teresa, your subgroup has 2 meetings scheduled, right?
October 1st and October 15th, both at 11 a.m.
October 1st and 15th, is that right? Is that what you said?
Correct.
1st and 15th. Okay. And then we'll have this one on the 8th, which we will use our October 8th to do another breakout, just FYI. So, and Chase, when is the direct caregiver? When is y'all's next outside of this meeting?
So our last one was actually last Tuesday. That was our 4th meeting. However, based on the objectives that we're writing, we're kind of separated them into 2 buckets. And so we'll have subgroups meet until November.
Okay.
We won't have those scheduled yet.
Perfect. Sounds great. All right. On the 50 plus, Mary or Monica, y'all want to share what we talked about, or the 3 of us will tag team? We get it started. All right, let me get back to my notes here. We talked about a lot. What a fabulous group we have on that one. Just some of the experts. Monica's already doing this. This is her life thing. So many of them are. But Mary came in with tons of ideas of, kind of. We have several issues going on with the 50 plus workforce group, and we have an employee and employer. So kind of dividing how we're looking at this on getting people into the workforce, but also employees accepting this workforce group. Diane, I think, had a great point of it's not just pulling people into it, but retaining them. Kind of turning that old ageism of trying to retire people out of that. So kind of part of our strategies is going to need to be looking at how this comes from family care. So I'm reading the thing that Teresa just sent on how they, how employees, so an employee and employer. And then Rosalie had a great concept too of it's not only just that, you got to divide even down another way, which goes into the strategy of 50 plus workforce group, and then maybe almost a 65 plus workforce group. You've got 2, and they come with 2 different objective strategies, and so we kind of already see that we might have a couple, we might have our 1 or 2 large objectives, but our strategies are kind of going to need to be broken down, employee to employer, and then, maybe 50 to 65 plus. So it was just a great one. We did talk a lot about, we already have a governor workforce group, and, that should be part of our partners. So we probably need to reach out to them. This is going on other outside in the country. And Monica, you might could speak on this one a little better when I finish up. It's, certified employers that are age friendly, and what that looks like. And maybe we need to be more inclusive of that within the state of Maryland. We did talk a lot about ageism and the misperception of older workers. And that is something that is going on in another work group, but I think it can carry on in all of our large objectives. There definitely is, an issue of ageism and the older worker, which just goes on. And a really common theme was, really needing to promote awareness that we need a 50 plus and a 65 plus in our workforce. We need awareness that there are job opportunities and career opportunities out there. We need awareness that employers should be seeking them out and thinking differently. So a lot of awareness that is happening, but really needs to continue and have a special focus on that one. So I really thought that was good. We'd also talked a lot about just the diversity of not just the older Marylander, but the diversity of the subgroups within that of the LGBTQ older Marylander, and how they are diverse into this conversation. Certainly very important. A little bit about, are there incentives to employers to do this? Training was a huge topic. We talked a lot about that. Career counseling, it's happening and job fairs happening, but maybe more inclusive to the older Marylander. I think that there are probably pockets of the state that are doing these things well, and how can we get this diversity, get this out to our diverse areas? And Monica, I didn't know if you could just maybe talk a little bit about, you talk the certifying of you do a lot in this area. You can bring some light to the rest of us on what's going on around the country elsewise that Maryland can learn from.
Okay, thanks, Leslie. Yeah, so the whole the term age friendly is defined. A number of counties in Maryland actually have this certification through WHO AARP, but then there is the Age Friendly Institute actually certifies employers, state employers, county employers, as well as public and private employers. And what that process is, there's 12 different categories that these employers have to demonstrate that they are age friendly, whether it includes comp and benefits, whether it includes training, opportunities, recruitment, being age neutral, phased retirement program, so forth and so forth. So there is a template that could be used. And we were talking about that really, if Maryland wants to be having this longevity ready initiative, well, then the state government needs to take a look at this and see whether that's something that should be built in, and then talk about being a model for employers that exist in the state. And maybe there are some incentives or policy that could be created around this. But we also talked about there's so many entities within the state that are doing work in this area. And we need to look at the responsibilities of these existing entities and maybe charge them when it comes to actually talking strategies. How do we use them to really make this longevity ready initiative, a reality for the state? So I guess the last thing was, I don't know, one of the ideas was we all had to write recommendations. What's one recommendation that you have? And we're going to take a look at all of them that were submitted from our work group and see if there's some common themes and how we could break these down. As Mary said, maybe there's some for employers versus employees. So is that?
Yeah, no, I just think this, I think it's great information. We did come up with, there's so much that we still kind of need to do. So we did have an ask of our subgroup that everyone is going to send, kind of do some thinking. What's a recommendation? What would be a recommendation of an objective for this particular subgroup? Julia, they're going to send it to you and I. We'll kind of house all that and we'll get it to Kathy. We're also going to be working on sending some reports. I think we have a lot of linked up reports already that are around this topic, but what else might be out there? And there are a lot of entities, as Monica and Diana, everyone shared, that are doing this in the state of Maryland. We do have CSEP, and Kathy is our big CSEP person. She wasn't here, but what else is going on? So that we're going to get this information to our subgroup, do our own kind of internal research. We're going to use our next meeting on the 8th which we will be doing breakout groups again, probably more around 45 minutes since we don't have to do as much intro and talking LRM at the beginning. And then we're going to kind of see what we can get through. And then, you know, keep on going. So that was a little of our kind of our follow-up to that. So I don't know from our subgroup if I missed anything or anyone has anything to add, or in general from any of the subgroups. I will add, so we do have, so there is the U.S. Department of Labor awarded, oh, now I'm looking at two things. So if somebody raise their hand, I can't. Karen, go ahead.
Talking about two things. Lower my hand. Turn the mic.
Yeah, go ahead.
It's
No,
this
that's all
late
right.
in the
Go
day.
ahead.
I just wanted to mention, and I think this is something that's overarching, I think, for all the committees in some way, shape, or form, which I didn't really get to touch on in our caregiving subcommittee, but I think behavioral health concerns are really a broad reaching issue, and that really impact across all the issues that we're talking about. And so I just want to make sure that we're keeping an eye to that, both behavioral health in terms of a mental health diagnosis, but also cognitive decline. They're really, really big concerns that I think impact everything that we do serving older adults in Maryland. So.
Yeah, absolutely, Karen. And there is another workforce group that is definitely working on that one, but I think that is one of those that covers the span, right? We all need to be talking about that one for sure. Absolutely. I will just share, so there's something was shared with me just on the labor. So the U.S. Department of Labor just awarded over 200 million in grants to 14 different states. And it was specific to provide training and career services to low-income older individuals who are seeking to enter or re-enter the workforce. And so Maryland was one. It looks like there's certain recipients. Goodwill received almost 15 million, and Center for Workforce Inclusion received about 30 million. And I'm just kind of reading. I don't know if anyone's aware of that particular grant. I'll send that out to the workforce group, but I don't know if anybody within our workforce, in our large group, knows anything about that. Do we have Department of Labor on here? Anybody? We may not, but so I'll send this out. Just it's more information to add, right, to the formula of things out there to support our causes. So a pretty big deal, Maryland being one of 14. So it's kind of nice to read. So I'll read more about that myself. I just kind of got it. So thanks for sharing. All right. Mavish or Julia, anything I missed? And Mavish, I think you were supposed to run this part. You know me, I told you I can't help myself. I just get to talk and I can't be quiet. My mother always said that to me. So
completely okay. We love to hear from you. So no worries at all.
Well, guys, I want to thank you for a great hour and a half. We got a few minutes, so I'll give you back to your day. Our next meeting is the 8th, same time, same bat channel. For those who are as old as me, who remembers that statement. We will use that time to break back up into our subgroups. In the meantime, we'll continue to work on our Google Drive and your access to resources and sharing things. I don't care what or how minute it is. If you got an idea and you wanted to share, send to Mavish, Julia, and myself, or one of us. We'll keep rotating this. I think a lot of the work comes after we're done and we're driving home and we get to thinking about things. And this is the beauty of a lot can really accomplish a tremendous amount. So if nobody has anything, I'm going to let everyone go back. Have a great Tuesday. Thank you so much for everything. And I will see everybody back in 2 weeks on October 8th. So enjoy your week and your weekend. Bye, guys.
Thank you.
Bye-bye.